Hello, my name is Dr. Shannon Tierney, and I am a breast surgeon with the Comprehensive Breast Center at Cherry Hill and surgical practices at First Hill at the Swedish Cancer Institute. I've been asked to speak with you today about understanding your treatment path. In this podcast, we will talk about how breast cancer develops, what to do with your diagnosis, and the surgical and other treatment options that are available to you. When you have been diagnosed with breast cancer, the first impulse is to act immediately. However, it is more important to learn about all your options and make a thoughtful decision. Don't worry, you have time to do all of this, and your cancer will not progress or spread while you consider what you want. To begin, let's discuss how breast cancer develops. The breast is composed of fat, milk glands, and milk ducts that carry the milk to the nipple. The majority of cancers begin within the milk ducts. A normal duct is lined with fairly bland-looking cells. These cells can build up, which is called hyperplasia, and in some cases, they can change into what is called atypia. These cells can further change into cancerous cells. If the cancerous cells are contained within the milk duct, it is considered a non-invasive cancer, ductal carcinoma in situ, or DCIS. If the cancerous cells are found outside of the milk ducts, it is considered an invasive cancer. That means that the cancer has the ability to escape the milk ducts and has a higher risk of moving to other parts of the body. If it does spread, it usually spreads to the lymph nodes first, and the lymph nodes will need to be evaluated at surgery for any signs of spread. When you get your diagnosis, the first step will be to determine the size of the cancer. You have likely already had a mammogram. Your doctor may choose to get an ultrasound or an MRI to better characterize the cancer and help to plan surgery, and sometimes even additional biopsies may be necessary. The different radiology images give us an idea of the size, but the final size cannot be determined until after surgery, when the pathologist is able to measure the cancer. Depending on the size and characteristics of the cancer, some additional tests may be ordered to determine if the cancer has spread, such as blood work, chest x-rays, PET scans, or bone scans. This helps your doctor to determine if medical treatments like chemotherapy need to be started right away. Additionally, your surgeon may have you meet with other physicians prior to surgery. You may meet with a medical oncologist to discuss whether you are likely to need chemotherapy or hormonal therapy either before or after surgery. You may meet with a radiation oncologist to discuss if and what types of radiation treatment you may need. If you are thinking about mastectomy with reconstruction, you may meet with a plastic surgeon to discuss the types of reconstruction and whether they can be done at the time of your mastectomy or delayed. You may meet with a genetic counselor if your surgeon suspects a gene mutation may have caused your breast cancer. Having this team in place will help to ensure that your care is organized and thoughtful, though it may seem a little frustrating when you want to start as soon as possible. It's hard not to worry, but even aggressive cancers grow pretty slowly. You'll do better if your treatment is done right the first time. If the cancer is small enough, you will have a choice about the type of surgery that you can undergo. The two surgical options are lumpectomy and mastectomy. A mastectomy is removal of the entire breast, leaving the skin and the chest wall muscle. The breast can be reconstructed afterwards, either using an implant filled with saline or silicone, or using the body's own tissues. If you choose not to have reconstruction, you will be flat on that side, but can wear a prosthetic breast that will look completely normal when you are clothed. A lumpectomy involves surgically removing the cancer with a rim of normal-appearing tissue, but leaving the remaining breast tissue. You will have a scar and may notice some changes in the shape of your breast, but in most cases the breast appears the same. Having a lumpectomy means that you will need to have radiation afterwards for it to be effective. Radiation is sometimes also required after mastectomy. The type of surgery you choose will not affect whether you need chemotherapy or not, because chemotherapy is designed to treat the whole body. The need for chemotherapy is determined by the size and aggressiveness of your cancer. We can offer both kinds of surgery because they are equally effective. There have been studies looking at thousands of women, following them for decades after their surgery, and the risk of death from cancer and the risk of disease spreading to other parts of the body are the same with both types of surgery. With a lumpectomy, however, there is a higher risk of the cancer coming back in that breast. If that happens, a mastectomy can be performed. The choice between the two surgical approaches is very much up to the individual. With each choice, there are risks and benefits, and your surgeon can help you to make the best choice for you. If your cancer is invasive, your surgeon will recommend a lymph node surgery. There are usually between 10 and 40 lymph nodes under the arm that drain lymph fluid from the breast and parts of the arm. The only way to be sure that the cancer has not spread is to remove some lymph nodes and check them for cancer under the microscope. If we know that cancer has spread to the lymph nodes, your surgeon will recommend removing all of the lymph nodes. Otherwise, we can first test the ones that are most likely to have been involved, the sentinel lymph nodes. Using a dye injected into the breast, your surgeon will take out the couple of lymph nodes that take up the dye, and the pathologist will evaluate those for cancer. If cancer is found, the rest of your lymph nodes get removed. This can usually be done at the same surgery. Though the goal is always to complete your care with one operation, cancer operations are not always so simple. Though the order may vary, most commonly surgery is the first step. After a few weeks of recovery, chemotherapy will be started if it is necessary. That usually takes about 3 to 6 months. Radiation treatment, if needed, comes next. Radiation usually takes 4 to 6 weeks. In most cases, your cancer treatment will be mostly complete after about 6 months. You may still get some form of treatment, like anti-hormone pills, or need to complete your reconstruction, and you will certainly be followed closely for the first few years after your treatment. Your surgeon, along with the other physicians, counselors, and nurses that make up your treatment team, will help to guide you through all of this. Thank you for listening to the Plugged Into Your Health Cancer Podcast program, Understanding Your Treatment Path, in the Breast Cancer series. For more information on breast cancer, you can contact your physician or visit the Cancer Education Center located at the Swedish Cancer Institute in the Arnold Pavilion on A Floor West.